Welcome everyone to our third stakeholder meeting. We're so glad you're attending. The point of these meetings is to engage with all the folks out there who are interested in what's happening with Kentucky Medicaid and the unwinding of the public health emergency and the restart of redeterminations. We know that this is going to be a great effort, and we appreciate everyone's interest and also their help in supporting our members through this process of the restarting of redetermination. So thank you for being with us. And I'm going to share my screen for the PowerPoint. I'm going to turn off my video, but when we come back for questions, then we'll turn our video back on. Thank you. Part of the public health emergency, we did put a lot of flexibilities in place. We made a lot of changes in order to keep individuals covered throughout the PHE. We implemented lots of flexibilities for our providers. And so now is the time that we're talking about unwinding all of those. We have three goals in particular for unwinding, very important. One is compliance with CMS requirements. If we do not stay in compliance, we put our federal match, which is the match that the federal government gives to us to offset our expenditures, and the majority of which comes from the federal government. And we'll be putting that in jeopardy if we don't meet compliance. The second, and really kind of critically important to us, is to prevent administrative terminations. By that, we mean that if somebody is eligible, but for some reason did not take action, if action was required before their end date, and they get administratively terminated or discontinued, and there's a gap in their coverage, we want to prevent those because we just do not want to see gaps in coverage. That's important to us. And so we want to make sure that individuals understand that if there is action necessary, they're aware of it and they're taking it prior to their end date. And then for those that are determined ineligible, and we do know that over the course of the 3 years that we've been under the public health emergency, some of our individuals have increased their income or are no longer eligible due to the category they were in. And what we want to ensure is that once the coverage ends for Medicaid, that they can transition smoothly and with no gap over to other coverage that is available to them. That may include the state-based marketplace and a qualified health plan. And we'll talk about some of those other things a little later on in the presentation. But those are our three goals in which we're moving forward with unwinding. As most of us all know now, we did receive that notice from the White House that the public health emergency is ending on May 11th. That has other implications for the flexibilities that we've been under, and we'll be ending those. But really what has restarted our efforts around redeterminations has been a new law passed in December called the Consolidated Appropriations Act 2023. And that act is what has ended the continuous coverage that everyone has been under, meaning that we could not terminate someone unless they met certain very limited circumstances, such as they moved out of state, they requested that their coverage be ended, or the member passed away. So there were very few reasons why over the past 3 years, someone may have lost their coverage. What the CAA did was separate that continuous coverage requirement from the public health emergency and ended it March 31st. So starting April 1st, which is Saturday, we will resume normal enrollment and eligibility operations. What that means is that anyone who comes in after April 1st no longer has that continuous coverage and could separate or have their coverage ended under our normal eligibility and enrollment rules. The CAA also is going to phase down the enhanced FMAP or federal match that we've been receiving over the past 3 years. They're doing that, thankfully, slowly, at least over towards the end of this year. But what's important about that is that enhanced AFMEP has been able to help us offset additional costs for keeping people continuously covered, for allowing us to implement some flexibilities and some provider reimbursement mechanisms to help offset costs. So as that ends, it is important for us to make sure that people that are covered by Medicaid are eligible. The CA also required a lot of new reporting requirements, and that's what we've been working on over the past couple of months, understanding those requirements and ensuring we're in compliance. CMS, as recent as 2 weeks ago, was further clarifying that guidance. We're still waiting for some written guidance. So it's been a bit of a challenge to make sure that we are in full compliance, but Kentucky has been told that it is currently fully in compliance with all of the requirements, and therefore is not requiring what's called a mitigation plan or have their enhanced FMAP in jeopardy. So we're in good shape so far, but the CA did impose some new compliance tools for CMS, the Centers for Medicare and Medicaid Services, who is our regulatory authority, to allow them to sanction or penalize agencies that are not in states that are not in compliance. So far, we're looking pretty good. This is a high-level timeline for renewals. On February 15th, we filed what's called a renewal redistribution plan and system readiness artifacts. We did file those. They are under review. CMS has reached out to us with a couple of questions, but once we get the sense that those are in good shape, we do plan to post them on our Unwinding website so that folks can see the information that we've provided to CMS. I'll get into the redistribution plan in a little bit. The system readiness artifacts really talks about our testing plan and returning the system to those normal processing that we were doing prior to the public health emergency, and just giving some reassurances that we're going to be properly adjudicating or determining eligibility for folks as we go through the 12-month unwinding period. March 31st, as I mentioned, is the end of continuous coverage. And so anyone after April 1 no longer has that coverage, except that, and we'll talk about this a little more, those folks that we have been keeping covered will get a new renewal date, and that will happen over 12 months, and we'll talk about that a little bit more. April 8th is our baseline unwinding data report that's due to CMS. This is going to be a snapshot of our population and everyone that is going to go through renewal. So that going forward, every month, the 8th of every month, we'll submit an updated report so they can track how many people have been redetermined, how many have unfortunately been discontinued or terminated, how many have moved over to a qualified health plan. So it's just CMS's way of providing some oversight of each state and the actions that they're taking. We do plan to post that as well on our Unwinding website, as well as each monthly report that goes to CMS. So May, next in just a little over a month, our first renewals will be those with an end date of May 31st. So I'll go over our redistribution plan, but there are some that will have and start with a May 31st end date. What that means is that they will start their redetermination about 60 days prior to that with a notice, and we've got an example to walk through to help understand that. But our renewal plan kicks off with May renewals, and then those will be conducted. All renewals will be conducted over a 12-month period, and so April 2024 will be the last month to go through a renewal as part of the unwinding. So I talked about our redistribution plan and what we also call our renewal caseload planning. And what we had to look at is our workforce and our workload, the number of individuals that we are going to have to redetermine. And Kentucky does theirs by the case. So a head of household and members of the household are generally in the same case. That means in Kentucky, we're going to have approximately 860,000 cases for the over 1.6 million individuals that are subject to a redetermination. Over the course of 12 months, from May till April, we have distributed the caseload. And we did that in a couple of ways. What we decided to do was align all members of a household to the same renewal date. As the PHE continued, that didn't always align. So now all members of a household in it will be part of a case, and that case will all have the same renewal date. We also aligned Medicaid, and for anybody with SNAP, we aligned their renewal dates. A household that has both SNAP and Medicaid will have their renewal dates aligned. The other thing that we did was, as you see on the slide, we have 3 priority populations. We did this so that we could focus our efforts and support and outreach with for these individuals when they're going through their redetermination. The first priority population is those what we call Medicare eligible. They're age 65 and older and qualify for Medicare and should file an application for Medicare when they turn 65. During the public health emergency, because they were covered by Medicaid and so they had coverage, some individuals did not, when they turned 65, did not go and file that Medicare application. Well, now that they're losing Medicaid, they will have to file that application. And to ensure that they are not penalized, there is a special enrollment period for members who are filing that Medicare application. What we have planned for them between May and October is to provide lots of outreach and support to help those individuals understand what's happening and the actions they need to take. That's what we're going to be doing for the Medicare eligible population over between May and October. The next priority population is what we're calling our special circumstance. There's about 14,000 individuals who in March of 2020 had been determined ineligible and were about to be discontinued and lose their coverage. But with the public health emergency continuous coverage requirement, we kept them covered and have been doing that since March 2020. So these individuals, again, already determined ineligible at the time, are going to be subject to a re-enrollment in June, and they'll receive a notice letting them know that they need to take action to be able to continue their coverage. We want, again, to provide a lot of support and outreach to these individuals. So we're making sure that we're going to track these individuals through the process and reach out to them if they've not filed that application to try to make sure they understand they need to, so we can determine that whether or not they're eligible for another category in Medicaid. And then the last priority population is what we call QHP eligible or qualified health plan eligible. We are going to start them in July, and then they will be distributed from July to April. The reason we did that is we're planning some system upgrades and some other outreach plans to support these individuals in moving over to the state-based health exchange, Connect. These are individuals that we hope will shop for a qualified health plan, choose a health plan, and then see no gap in their coverage. There is also a special enrollment period for these individuals. As they lose their Medicaid eligibility, they become eligible for a qualified health plan. It is a life-changing event, and so they will be able to access when their renewal date comes up, regardless of when it is in that period, they will have the ability to access a qualified health plan. So we want to make sure they take that action prior to their end date and again, plan a lot of support for them through the unwinding. In terms of our caseload distribution from May to April, a couple of the other things that we took into consideration, and I mentioned one of them, which is workforce and workload. In December, we know we have the shortest work days. So we have the lowest caseload in December to be able to handle the cases in that month. And also open enrollment is going pretty strong in December. So we wanted to make the caseload as low as possible in that month. In May, June, and July, our caseloads are a little lower than they are at the end of the unwinding period in February, March, and April. We did that because we want to be able to ensure the system's working appropriately, that we don't identify any other issues, and we want to monitor the workload in accordance with the workforce and see if we need to make any changes as the larger caseloads come towards the end of the unwinding period. So it gives us the ability to learn some lessons and implement some resolutions prior to when that happens. We're really trying to make sure everyone understands not everybody is getting renewed in May, and it will be distributed across the 12-month period. Our system, Kentucky Health Net, our system ran our distribution plan on Sunday last week. And so then all of the new dates, everyone's new renewal date is now in the system and should be accurate. In Kentucky Health Net, we are making a change for providers to be able to access that redetermination date. And on April 7th, providers will be able to go into Kentucky Health Net and see on the members' eligibility panel in red their new redetermination date. That's one way they'll be able to track that. As of March 25th, anybody who looks in the system and sees a redetermination date, that is the accurate redetermination date based on our redistribution plan. So what we tried to do is show you what that renewal process looks like. So this looks a little busy, but certainly when you get the slides, you can take some time to look through it. It does reflect that in 1 month, several things are happening. And so we wanted to walk through that. And we're going to focus on the May renewals, but this shows in the green, it shows all the actions and activities that are tied to a May renewal. The lighter blue are actions and activities that take place for June renewals. The kind of beige color on my screen is the activities and actions for July renewals. And then we've got August on there in the darker blue. So let's walk through what a March renewal looks like. So as I mentioned, we just the system just updated this past week all the new renewal dates. Generally, a member will receive some type of communication about 90 days before their end date. The caveat being May renewals, since we just updated their renewal dates. But they will be receiving a notice, and that's by text or email, some type of communication that says your end date is approaching. So they will be notified that they have a May renewal and what their May end date is. On April 1, our system will go out and do what's called an ex parte, which means an automatic renewal where the member does not have to provide any information or take any action. The system goes out and tries to check all the databases that are out there and available to us. We have an asset verification system. We have something that goes out and checks for income. So the system's going to go out and try to do that on April 1st. And if they're able to verify, that's called a passive renewal. Nothing else has to happen for that member. They don't have to take any additional action. And so that second block down under April, the May passive renewals that are successfully verified will get issued a notice of renewal. They'll get that notice of eligibility that says, we were able to determine you eligible, and now your renewal date will be moved forward 12 months. So their renewal date will go from May 31st, 2023 to May 31st, 2024. But if for some reason the system just couldn't verify everything that it needed to verify, then the system will issue a request for information. And all this takes place about 90 days prior to their end date. It kind of just depends on how many days are in the month and when the system completes, because it has to take a couple of days to get through all that verification. But most individuals, 45 to 60 days prior to the end date, will receive a request for information if we were not able to passively renew them. Then the third bucket is that fourth bucket down, fourth May active renewals. So these are individuals where additional information we already know is required. There are resources involved in their determination, and not all of that can be verified electronically and automatically. So those individuals will be what we call an active renewal, and they'll be issued that renewal packet also about 45 to 60 days prior to their end date. And then that last bucket there at the end of April, in April, the June renewals will receive a text or email notification about 90 days prior to their end date, notifying them that their month of renewal is June, and they will need to keep an eye out for further communication. So come May, the May active renewals and the passive renewals with a request for information or RFI will continue to process and will be monitored to ensure that there is a response being provided by the member who's going through either the active renewal or who has an RFI. If by the 15th of the month, that for somebody who's received a renewal packet, they will receive another notice that we've not heard from them. We've not received no information that they need to take action. Hopefully that will prompt them to reach out. For those with an RFI, they will also receive a communication to let them know that we are awaiting their information. A lot of outreach is planned for anyone who has an active renewal or an RFI that has to be returned to verify or provide information. There will be calls going out from the managed care organizations on behalf of their members, the call center, the Cabinet's call center for DCBS and DMS, the Department of Community-Based Services and Medicaid will be following up with calls to individuals. Our return mail processing will be looking for any returned RFIs or active renewals so that we can reach out to those folks to make sure that we have the most current address on file. So there's a lot of outreach that'll be going to these individuals who have to return information. So that just walks through May, but the same thing happens for June, for July, and throughout the 12-month period. These are examples of what a notice that a member may receive. The far left is a notice of eligibility. So it will let someone know in particular if we went out and were able to verify eligibility, that their coverage date has been updated to reflect that. The middle notice is what a request for information would look like. This and the renewal packet, they both will be pre-populated with whatever information we have available, and will only ask for the information that's necessary to do the eligibility determination. And it will tell them exactly what it is we need and what kind of documents comply with that. Both the RFI, the middle document, and then the far right is the renewal packet. Again, just asking for the information that we need to make that determination. How does a member respond? There are multiple ways a member can respond to a request. So the first is they could complete it and return it either by fax or by mail. They could use the online self-service portal on Connect. And if they've gotten a renewal packet, then they click on renewal benefits, or they will see that they have to upload requested information from an RFI. We are really encouraging as many people as possible to utilize Connect and the self-service portal. And the reason is because it will be the fastest and easiest way for us to complete that redetermination for a member. So right now we've been, as we're going around talking with folks, is encouraging members to create that Connect account or go on to their Connect account and make sure they don't have any issues, so that that can all be done and ready and waiting for when they have to renew, for when their renewal month comes up. So right now, really encouraging everyone to go check that Connect account, make sure it's active. And if they're having any troubles accessing it or creating one, that we can work through those right now. If they need help, they can also call our Connect hotline or our DCBS line Monday through Friday from 8 to 4:30. Or the DCBS line is also available on Saturdays from 9 to 2. Or they could visit a connector, an insurance agent, or the DCBS office. And there's a way to find any of those. We've provided the hyperlinks, but you can always Google Kentucky Medicaid connector or Connect, find a connector, find an insurance agent, Kentucky, and you will get to where you can look for a local connector or insurance agent and contact them and be able to get assistance from them or to find a DCBS office. We thought it might be easier to understand some of these scenarios where somebody might be passively renewed, receive an RFI or a renewal packet. So this is Erica Smith. Her renewal due date is May 31st, 2023. And her case can be passively renewed. Connect on, like I said, April 1st, for those with a May renewal, is going to go out and try to verify information, the data, all the data sources that are available. And it was successful in verifying that information. So then a notice of eligibility will be generated for Erica, and Erica will get a notice that says, there's nothing further for her to do. Her coverage has been redetermined, and now her coverage date will move to May 31st, 2024. No further action from Erica. But Jason Johnson has a renewal due date of August 31st, 2023. And our system went out and tried to do the verification on July 1st, but wasn't able to verify everything. So we need to get a verification from Jason directly, or maybe even some additional information. So between around July 8th, the request for information will be sent to Jason. If Jason does not submit his documentation by August 15th, a reminder will be, we will do outreach to Jason to make Jason aware of the need to do something before August 31st. If by August 31st, Jason takes no action, does not submit verification, then Jason will be discontinued and be sent a notice letting him know that his coverage has ended. If Jason, and if he receives that discontinuation notice, Jason does have 90 days past his end date to submit the information. So we will actually have plans to reach out to individuals past their end date for that 90 days to make sure they understand they could still provide that information. And if they do, within that 90-day period, and they're determined eligible, we will be able to reinstate them retroactively back to their end date, so there will be no gap in coverage. Jason also, when he receives that discontinue notice, will have 120 days to file an appeal of his notice and request a fair hearing. If Jason did submit the documentation prior to August 31st, and the state hasn't taken action on it, Jason's coverage will be extended until the state makes a determination. Once that determination is made, then Jason will receive that notice, and if ineligible, will also be granted appeal rights of up to 120 days. The important thing here is that Jason has to take action. And we are all going to be doing whatever we can to make him aware of that, help him overcome any barriers to providing that information or that verification. And then the last case is someone that might get an active renewal packet. So Tom Starr's renewal due date is January 31st, 2024. He's going to go through an active renewal after the system does attempt to verify whatever data we have available. But Tom's eligibility is dependent on resources, and there are just some information we cannot verify. So he will receive a pre-populated renewal form to complete and return. December 1st, attempt to verify will happen, but the renewal packet will be sent on or about December 12th. If Tom takes no action by January 15th, he will receive a notice saying we've not heard from him. If he still does not return the information or verify the information by January 31st, his coverage will end, and he will receive a notice that tells him of his coverage ending. If he receives that notice, Tom has 90 days after his end date to still provide that information to us. And if he does that and determined eligible, we will reinstate his coverage retroactively back to January 31st, and there'll be no gap in coverage. Tom also has 120 days to appeal and request a fair hearing. If Tom sends the renewal packet back to us and it hasn't been processed by January 31st, then Tom's coverage will be extended until the state can make that determination. At that time, if he's eligible, he'll receive a notice of eligibility, if saying that he's been redetermined, and get a new redetermination date. That's 12 months. If he's not unable to be redetermined, then he will have the ability to appeal that notice of ineligibility. But again, the important thing here is that Tom will have to take action, and we will do all we can to make sure that Tom does take that action. So this information we've been providing, it's called a snapshot. On March 6th, and every month prior to March 6th, we've been monitoring with our system what it looks like in terms of people's eligibility. So the system throughout the 3 years has continued that ex parte passively renewing folks in the background. What it hasn't done is taken action to discontinue somebody if it's been unable to determine their eligibility, or if the system has determined them ineligible. So in doing that, we have about 236,000 individuals that our system either can show are no longer eligible based on that snapshot, or we don't have enough information to make that determination. Keep in mind that these individuals and their cases are distributed over 12 months. So all these individuals are not in May. They are distributed over the 12-month period. Of those 236,000, the system does show us that about 74,700 are over 138% of the federal poverty level, which is the Medicaid eligibility income level. If they're over 138%, they would likely qualify for other coverage, such as a qualified health plan on the state-based exchange, and even advanced premium tax credits, which could make their premiums zero or very low. So these are the 74,000 plus are the ones we're really going to be focused on, and anybody when their redetermination happens and they're determined over Medicaid income levels, to understand that there are options available. The state-based Marketplace Connect is going to be where we'll be sending these individuals and help them shop for a plan and enroll in a plan, hopefully with no gap in coverage. The other thing I like to point out with this slide is that this snapshot on March 6th does not mean that all these individuals are ineligible. When their redetermination comes up, their circumstances could have changed between now and then. So some of these members may lose income. Some of these members may qualify for another Medicaid category, because that's what we're going to attempt to do for anyone that loses their eligibility. We'll check to see if they're qualified for any Medicaid category. So it's very possible that the 236,000 is lower based on their circumstance at the time of their renewal. It also means it could be higher if other people's circumstances have changed since we pulled the number. And then in the box in the middle, the lower middle, we just tried to show what the age range are for those individuals. You see that 65 or older, we have just under 18,000 individuals. What we do know is that the majority of those did file for Medicare during the public health emergency when they qualified to do so. So we're really only talking about 800 to 1,000 individuals that we're going to need to help take that action so they don't lose any coverage. And then we're going to be closely monitoring the children, those 18 or younger, to see if perhaps they could qualify for another category, or that they're part of a case or a household that moves to a qualified health plan. And then we just took a little bit different demographic shot of those individuals. As you can see, we've got some people in categories that no longer are eligible for that category: children over 19, pregnant women outside of the 12-month postpartum, which Medicaid did expand postpartum to 12 months for pregnant women. Former foster kids that have been covered once they reach 26. After they reach the age of 27, then they're no longer eligible. And then you see our HCBS waivers. We're tracking some individuals in our HCBS waivers, our home and community-based services waivers, that our system is showing either we can't confirm their eligibility or there's something that makes them no longer eligible. So again, what we've been trying to convey to everyone that we speak to about this is that members should get on Connect, check their account. They should keep their contact information current. Very important over the course of the 12 months that members have given us, either through their Connect account or by calling Connect, and update their contact information. It would be great if we could get a phone number where we could reach them, an email address. We understand that there are a lot of folks out there trying to help by providing assistance with accessing a phone or an email address, and then their mailing address, so that they receive that notice and know that they have to take action. But we are really going to reach out to members through all modes of communication that we have on file with them. And so it's important that they keep that current. And then when they get that notice that there is the renewal is coming up, that they keep checking back and keep an eye out for a notice from the state about their coverage. We're referring them to a connector or a licensed insurance agent, Connect phone line. For those 65 years and older, we've been working with the state health insurance program, SHIP, to help. The SHIP hotline will help those members find other coverage and apply for Medicare and understand what they need to do to apply for Medicare. And our sister agency, the Department for Aging and Independent Living, is also providing that support. So we're encouraging our seniors and anyone age 65 and older to reach out to those folks and get the help they might need. And then referring everybody to our Unwinding website, because that is where we're trying to keep all things public health emergency and redetermination, restarts, information available as things change, as much information as we can get out there. Communication is absolutely the key. And we know that folks on the call today are going to be part of that. We need our providers to help members understand that renewals are starting and the importance of responding to a notice. They'll have access to that redetermination date. So if they're in your office and you're having, a visit with them, that if you've checked their eligibility and you see they have an upcoming renewal date, to make sure that they've got their contact information, is just ask those really simple, quick, easy questions. Is your contact information updated? And have you responded or received a notice to respond? And also, we're providing some flyers on our website to help people understand that you could hand to them so they know who to contact if they need help, because help is out there if they could just access it, and we can all make them aware of how to access it. Our sister agencies are helping out. Our Department for Public Health, we're particularly trying to reach out through their maternal and child health branch to reach out to their organizations they work with so we can ensure that pregnant women and those with children that they interact with understand what's happening. Our behavioral health, our Department for Behavioral Health is also assisting us with ensuring that providers, their providers understand that support Medicaid members and see Medicaid members understand what's going on. Our managed care organizations are going to play a big role. As I mentioned, they're going to be outreaching to their members. So both up until their end date and 60 and up to 90 days after their end date. And then all our advocacy and community-based organizations have already been a huge amount of help to us. And we know that they are going to be out there helping get the communication to everyone to support Medicaid beneficiaries going through that redetermination. But we're doing it in various ways. We are planning a campaign, it particularly to our more marginalized populations, and trying to get the word out in the communities across the state that this is happening and to be aware of it. So you'll see a lot of campaign out there talking about that through TV and radio. And again, on our website, we're hoping that folks pull down the flyers that we've prepared and post them in offices or hand them out to members so that they understand what's going on. So really a very multifaceted approach through communications. And I've talked already about a lot of the approaches that we're taking, that managed care, utilizing their member services to call, to mail, to text their members who have opted in. Our contact center doing direct outreach. They already, after April 1, understand who's going to get that RFI or that renewal packet and are going to start calling to all those individuals and get to as many as we can. And as their end date approaches, reaching back out to anybody who hasn't responded. We know our connectors and insurance agents across the state are going to be doing a lot to support this membership, helping take applications, helping them. They can update contact information and connect for them. So they're going to be doing a lot. We'll be tracking, as I mentioned, the return mail so that we can see if a renewal packet or an RFI comes back in, that we reach out to that individual, and if their mailing address had changed, we can update that and resend the packet within 30 days. So we'll be tracking that. Our providers and provider associations have allowed us to come talk to them about what we're doing, and we appreciate them getting that out to all their members and keeping them aware. We planned some reports in CLOCs, the Kentucky Level of Care, that our nursing facilities and some other providers utilize. They're going to be able to pull a report to show their patient's redetermination date to make it a little easier for them to reach out to their patient and help them go through whatever actions they need to take to have us do their redetermination. So we appreciate that support that they're going to be very proactive with. Again, coordinating with our sister agencies and with SHIP, and those community advocacy organizations are just invaluable for the work that they do with the Medicaid population. And I want to, we're getting close on time, so I just want to go through this. We do plan in early April a provider-specific PHE flexibility unwinding seminar, webinar that will talk a little bit more about all the flexibilities we put in place and how we're going to unwind those. We also will be posting on our website a comprehensive list of all the flexibilities and the actions that we're taking to unwind or extend or put in place permanently. So I do always like to note that while most of the flexibilities end on May 11th, those with the Home and Community-Based Services Appendix K do not end until 6 months after that, so November 11th. And we will continue to do outreach to those individuals and providers to understand what those flexibilities are and what may be ending or may be put permanently into place. A couple of things I want to note really quickly. Provider revalidations will no longer be suspended. The provider enrollment will be letting providers know when their revalidation is due. Not all of them are due in May, so don't panic. It will be, again, an unwinding period for those, and because we couldn't handle doing them all at once. So you'll be notified when your revalidation is required. We stopped recoupments and payment intercepts. Those will also restart, but if provider has financial hardship, we certainly are happy to talk with them. The second presumptive eligibility period for members through the public health emergency, we allowed 2 in 1 calendar year, so up to 4 months of coverage while the member filed for a full application. That the second period will go away after May 11th. And then some reimbursements that we were able to add as a flexibility only during the public health emergency will be going away. We've extended some flexibilities. For instance, we're required to still cover all COVID-19 vaccines, testing, and treatments, and that's without cost sharing, although in Kentucky Medicaid, there is no cost sharing, so that's helpful. The telehealth audio only, that's been waived, and the non-compliant HIPAA compliant platforms that's been waived during the public health emergency will continue till December of 2024. That's on the federal level, and so Kentucky follows that. A couple of other things I mentioned, the members will have 120 days to file an appeal, and the state will have additional time to make a decision, and then any member who's re-enrolled within 120 days will go back to their previous MCO, although they always have the option to change MCOs. And then, we did put permanently into place much of the expanded telehealth flexibilities, and that's in 907 KR 3170. Please check our unwinding website. This stakeholder presentation and a recording will be posted on that shortly. And we're going to keep an FAQ or frequently asked questions document that will be updated as frequently as we get questions and can respond. So keep an eye out for that. Our social media is going to be the best way to stay on top of all things unwinding and redeterminations. It's going to be, a quick way for us to let folks know what's happening, if there's trends, if we've made changes, if we want to alert about something that's going on. When we post something to our unwinding website, we'll notify folks through those social media as well. This is our last regular stakeholder meeting in March, but we will have at least one ongoing stakeholder meeting every month during the unwinding. It'll be the third Thursday at 11. Everyone is welcome to attend that. We'll continue to take questions. We will present information, including our reports to CMS. We'll walk through the actions that we've taken and keep everyone updated on how things are going. So now I'm going to stop sharing, and we just have we just have a little bit of time. There's a lot of information. So I don't know, Helen, if you want to ask a question or
I think I would just, I
Okay.
want to talk to a couple because I did see a bit of a trend in the chat. First off, I was hoping, Veronica, and I know this was referenced a little bit at the end with the flexibilities in the plan that Kentucky has in place, but could you speak specifically to some of the items around telehealth and where that will be, as well as the timing for the availability of various platforms in line with the federal laws around HIPAA compliance and timing?
Absolutely. Well, so again, in terms of of what providers can do for telehealth, the services that are covered through telehealth, we did implement much of that through our regulation. In terms of the platforms and the non-HIPAA platforms, and we understand that that's created a great deal of access for individuals. The good news is that the federal law does require that to still be utilized through December of 2024. And as that may change, we'll certainly keep everyone notified. But at least for the time being, we know that we have it until then.
Thank you. Just want to confirm that what can be updated in Connect and then by who? I think we're getting a couple questions around there.
So obviously a member can update their contact information and pretty much anything in their account. A connector can update contact information as well. So they have the ability to change or add phone numbers, email addresses. Certainly they could do that if they call Connect. That is something that they can also make a request for. There are some additional, I think, processes to verify the information or verify the person that's making the request. But or you could come into a DCBS office and try to get your information updated that way. When a member is using the self-service portal, we made a couple of changes that now on their mobile, they can take a picture and upload documents. So we've tried to make it really easy for individuals to respond to a request for information. So they can take a picture, upload it on their mobile app. They could scan it and send it through their computer. We know that not all members have access to a phone or computer, and sometimes it's a little more difficult for our senior population. But that's why we have connectors and insurance agents and DCBS offices available to help individuals provide that.
Great, thank you. So I know we had a couple other questions come in, and we've had some questions come in through registration. So appreciate everybody taking the time to submit those. We will be cataloging everything that's come in through the chat through all 3 sessions and come in through registration. So we will be creating a FAQ document that will go up on the website also, and it'll be up there with this other stakeholder engagement meeting information. So that should come with the slides from these sessions so that you can reference going forward, the recording of Veronica going through everything today, that FAQ, and then we'll also have a place for you to access the monthly meetings and continue to submit questions that way for us too, so we can be responsive to what you're hearing on the ground and what you may need. We're open to any questions and we are here to help. So the more questions you give us, the better we can serve you.
One of the things, be inclusive and responsive in creating the documents that we have on our website. But, we know that sometimes you all are in different situations or may look at it through a different lens. So if there is additional flyers, brochures, information that could be conveyed differently, we welcome that input and feedback and that request. So as you all are pulling that information down and taking a look at it, if you think that you need something differently, we're happy to be responsive to that.
Well, thank you for taking this hour, everybody, to attend with us and listen in. We're coming up on this April 1st timing, so we're right in the thick of it, but we feel comfortable and confident with everybody here doing a lot of work on making sure our members can stay covered and have access to care. So thank you all.
Thank you.